Hello everyone! Today we're going to learn about the different parts of Medicare, any costs associated with them, the gaps you need to keep in mind, and the questions you have to ask yourself when making decisions about the coverage you will select. Make sure to subscribe, like, and share my content, and contact me with any questions, also to schedule a one-on-one consultation and to get your coverage started. Medicare Part A is your hospital coverage. Most people will not pay anything for this at the time of retirement, since they've already paid into it during their work life and have satisfied the time length requirements personally or through their spouse. The coverage has a $1,600 deductible for each benefit period, which resets after not receiving inpatient care or being in a skilled nursing facility for 60 days. After paying your Part A deductible, the first 60 days of hospitalization have a $0 copay. Days 61 through 90 have a $400 daily copay. And in case of needing hospitalization beyond those 90 days, you have an additional 60 days in what is called a lifetime reserve with an $800 daily copay. Keep in mind that once those 60 days from the lifetime reserve are used, they are gone for good. Some additional coverage Part A provides is a limited skilled nursing facility benefit. To qualify for this, you must have been hospitalized for 3 full days, not including observation, and need to be sent to a skilled nursing facility. Keep in mind that this benefit does not include custodial care, only skilled nursing. If you qualify to receive this coverage, Medicare will cover the first 20 days with a $0 copay, and days 21 through 100 with a daily $200 copay. It is important to note that there are no medical plans through Medicare that provide custodial coverage. This is something that can be purchased as a separate policy through a limited number of companies. Long-term care coverage is definitely something I can offer through a couple of different policies, but I will discuss these in a later video. If you need information before then, make sure to reach out, and keep in mind that the younger you are, the more affordable they are, but you do have to be at least 50 years of age to apply. Most people that decide to take out Social Security get automatically enrolled in Part B. But if you need to do it yourself, you can easily do so online through the Social Security Administration official website, or you can give them a call. You should receive a Medicare red, white, and blue card with your Medicare Part A and your Medicare Part B effective dates. The Medicare Part B is your medical coverage for anything other than what's included in Part A. This would include your regular doctor's office visits, lab work, specialists, etc. Most people pay the lowest monthly premium for Part B, which for 2023 it is $164.90. However, if you're a high earner, you might fall in a different bracket where you might pay a higher monthly premium. Medicare Part B has an annual deductible of $226, and after covering that deductible, the co-insurance is a split of 80-20, with the insured paying 20% of all eligible charges. It is important to note that there is no maximum out-of-pocket for an original Medicare, so that 20% can be quite high depending on what you get done. Now, do not freak out. There are ways to protect yourself and your pocket. This is where Medicare supplements and Advantage plans would come in. Make sure to stay tuned, as I will be discussing those options in another video. Part C is where Medicare Advantage plans fall in. Medicare allocates your Medicare funds to a third party. The carrier you choose will manage your medical benefits, and those will be based on a schedule of benefits with a variety of copays for different services. Most of them also include prescription drug plans and even coverage for other services such as dental, vision, and hearing, among other perks. You also don't have to worry about a medical deductible, and they protect you with a maximum out-of-pocket so that you never have to spend more than a limited amount of money every year. The only exception to this is for kidney dialysis and chemo treatment administered outside of a hospital. For those two instances, the 20% co-insurance will apply, and the maximum out-of-pocket doesn't count towards that. A way that you can help yourself cover that 20% gap is by obtaining a critical illness policy that can pay out an amount in case of a diagnosis that may need dialysis or chemo. There are plenty of Advantage plans to choose from, so it is a good idea to have an independent agent like me show you the plans, compare the differences, and help you make the best decision possible. The company I represent, Bankers Life, partners with several carriers to offer an unbiased perspective and help you compare those choices side by side. It is actually a great thing that there are so many plans out there for you, because you're not obligated to stay with a single plan forever. And the carriers, they're constantly competing against each other, trying to offer a better plan. So you can try one out, and if you're unhappy, you can switch to another plan during an open enrollment period. A good agent should do an annual review with you to go over any Medicare changes, new available plans, changes in medication formularies, and more. Your annual review is actually the best time to discuss other options with your agent and make sure that you're always in the best plan possible for your specific needs. Medicare Part D is a prescription drug plan, and just like Advantage plans, the prescription drug plans are managed by a third party. This coverage is purchased separately, and there is a small monthly premium associated with it. The prescription formulary, tier levels, and copays vary from plan to plan, so it is important to compare and review the medications you are currently on to make sure you get the plan that covers your medications the best. The prescription drug plans also have a deductible for certain tier levels, so it is important to verify that as well. If you decide to enroll in an Advantage plan, there's no need to purchase a separate drug plan as it is already included. However, if you keep original Medicare as your only coverage, or if you sign up for a Medicare supplement, it is recommended for you to sign up for a prescription drug plan since they don't cover medications. If you go with a supplement or original Medicare and decide not to enroll in a prescription drug plan, maybe because you're not taking any medications at the time of enrollment, if you decide to enroll at a later time, you will be assessed a penalty for the time you didn't sign up for one since becoming eligible. And it is important to note that the penalty assessed will be in place for life. So let's try to avoid that. Now you know the different parts of Medicare. It can be a bit confusing at first, but please reach out with any and all of your questions. I will be happy to answer them. I am trying to break things into small digestible sessions, and I welcome suggestions as to what kind of information you would like to see. Please keep in mind that the health insurance industry is ever changing, so the information I provided is current as of this year. If at any moment changes come up, I will give a refresher. I will go into more detail regarding Advantage plans and Medicare supplements in my next video, so please stay tuned and see you next time.